Okay, is this everybody? Let's go ahead and get started, okay? First things first. Oh, I'm sorry I'm late. I had to sit out in my car for 20 minutes and convince myself that I really needed this job. Thank you. Okay, so we have 3 patients that are requiring sitters tonight, and we only have 1 sitter. So we're gonna have all those patients' rooms next to each other, and then we're gonna have the sitter sit out in a chair with wheels on it and just kind of spin around and look at all 3 of the patients' rooms at the same time. That's policy. Thank you. Okay, whoever's giving a report to Janet, she'll be here. She's just running late. She had to take her boyfriend to the ER. He got a new job at Subway. First day on the job, he cut his finger off. Just chopped it right off, okay? So they took him to the ER. They said they could reattach it, but he said, no, that's cool. Turned out that he had 6 fingers on that hand. So now he's just normal fingered. Oh, and they're suing the Subway because they let him work with knives after he had had 4 beers. Those people need a TV show. Thank you. Let's go to the suggestion box. This one says, if you change all your patients' TVs to the same channel and you time it right, you can watch a whole movie while you're passing out meds. That's true. I like to do the Hallmark Mysteries channel. Thank you. Okay, well, you guys have a great shift. Try to get your patients to sleep early tonight because we have a fire drill at 3 a.m. Okay, is this everybody? Let's go ahead and get started, okay? First things first, medication errors. So I know that basically all the scanners are broken in the room, so we can't scan the medication. So just remember to use the 5 rights, okay? It's the right person, the right medication, the right time, the right to an attorney. Thank you. Oh, I want to apologize. I knocked somebody's lunch out of the fridge all over the floor. I had to throw it away. Who brought their lunch today in an unmarked white plastic grocery bag? All of you did? Okay. Okay, sorry about that. We'll figure out whose it was. Thank you. Okay, so it's that time again to do the leadership evaluations online. Okay, so it's completely anonymous because they want you to really speak your mind and let them know what you think about management and how everything is going. So just go to the personalized URL they sent you in your email and then log in with your Epic username and password. So you can go in there and fill it out totally anonymously. Thank you. Let's go to the suggestion box, okay? This one says, for our high fall risk patients, why can't we just put them on the ground with a pillow and a blanket? I don't know. Okay, so the old grandma on 413, she's 89 years old in a full code. She keeps talking to her invisible grandparents in the corner. Does anybody know what that means? You guys have a great shift. Okay, is this everybody? Let's go ahead and get started. First things first. Okay, you guys know this. It's a HIPAA violation to look up somebody's account if you're not part of their direct care team, okay? No matter how hilarious their diagnosis is, don't look up somebody's account. Don't find an excuse to go in their room, okay? Yes, 414 has priapism. He got it from a medication side effect, okay? And yes, he sleeps on his back. And yes, we're low on IV poles, so we've been using it to hang his fluids. But it's a HIPAA violation. Thank you. Let's see. So Janet has been acting manager now for about 48 hours, and basically everyone on this floor has been written up. Okay? Especially poor Larry, and Larry's cool, but it's because they have a history. You guys remember when Janet and Larry went out to the car to talk that one day, and Larry came back all red and sweaty, and Janet came back all pregnant? Thank you. Let's go to the suggestion box. This one says, can we please stop yelling quiet hours over the intercom at 9 o'clock? Yes. Okay, it scares me every single time. I always think it's a code or something. Okay, well, you guys have a great shift. Just know that we have gone back to pre-COVID policy when it comes to visitors. So they can have whoever they want up here, even during the nighttime. So that means basically all night you're going to be looking for chair beds.